So there's a couple ways of measuring progress. I'm certainly um, what the way that most patients come into the program thinking that they are going to measure progress is the number of medications they've come off of, or how much weight they've lost, or how much their blood pressure has come down, or how much their cholesterol has decreased. And those are all good, and we celebrate those. But those are sort of outcomes based ways of measuring progress. The kind of progress I'm really interested in is behavioral progress, which is much more focused on the process. So let's just take an example of exercise, right? Um, Usually people have set some goal like, I want to run a marathon, or I want to run a 10K. And again, that's a very outcomes focused one. But when I take a step back, what we're really interested in is someone developing a healthy, lifelong pattern of essentially daily movement, right? And often you see people who do something like a race and they get all geared up. And then after the race is over, it's like their sense of purpose in terms of exercise has gone away. So they will often stop exercising. I hear that over and over and over again. But if you're focused on it from a process point of view or habit point of view, now you're going to measure progress by number of days in a week on a long-term basis that that person has exercised, right? So let's pretend we're taking one of my patients who is sedentary and not exercising at all. Then I will sort of ask the patient what they think they could realistically do that would get them outside and moving around 5 out of 7 days a week, you know. And maybe it's only 10 minutes, maybe it's only 5 minutes, but that's a start. And so I will take it and say, let's just maintain that consistently for however many 2-3 weeks. And then once that's become a pattern, then at least you're moving every day and you can easily build on that. So if I was to check back in with that patient a month later, my measure of progress would not be how fast their mile time is or some sort of outcomes based one. It would really be how consistent were you about doing the 5 out of 7 days and actually doing what you said you would do, with whether it's the 5 minutes or 10 minutes. That's kind of the ones I'm more interested in. Or let's take food. People struggle with eating out, right? And that's a real difficulty for them. So I will kind of ask them, what's a reasonable amount that you could eat out that's still a lot less than what you're currently doing? And maybe it's twice a week. So what I'll be measuring with them is how consistent are they week to week about limiting their eating out to 2 times. And those sorts of goals get people focused more on their behaviors and their habits. And the idea is that if you get your behaviors and habits right, then the outcomes will take care of themselves, right? And so then you can use these outcomes like weight and medications to sort of ask yourself, am I getting my behaviors right? If my weight's not going down, then maybe I'm doing some things right, but I need to be doing more. And so you need to change the behaviors. But it's always trying to get them focused on the behaviors and using the objective measures as sort of a feedback for whether we're getting the habits and the behaviors right. The other way, so we talked about sort of objective measures, we've talked about habits and sort of processes and behaviors. Another one is sort of a measure of progress is knowing that in the past, in a certain situation, you would have done X, but then now in that same situation, you find yourself doing Y, which is a healthier one. So in the past, when you went to a friend's house for dinner, you would end up eating a lot of unhealthy foods. That had been your pattern previously. But now you start to see yourself when you go to a friend's house, you've changed things around and you're eating beforehand. So even if you're partaking of the food there, it's a much smaller amount. So it's these moments that patients have this sort of before after feeling. I know in the past that this is what I would have done in an unhealthy manner, and now I find myself doing this. Those are very valuable because that's essentially, proof to themselves that they're changing their whole way of being.